is Fatima and I am a sophomore at Basis Tucson North. I am doing research at the Parkinson's lab with Dr. Cowan, and my mentor is Avi.
Hi, my name is Sophia Buchanan. I just graduated from Basis Tucson North, and I'm an incoming freshman at the U of A.
Hi, so right now I am measuring out the wire using the scissors to cut it. Now I am trying to fold the ends together. It takes quite a process. Even it out and then refold it again. And then we're going to use a clip that's made out of magnet to hold it together. And then place it on the holder, the wire holder. You open it out like that, and then you try to adjust it in the spinner, which takes a lot of work. There. Perfect, just like that. Once we have done that, we turn on the device. Wait for it to show left and right, 0, 0, perfect. Now we turn it to the right until it gets to 100. I went over. And then turn it to the left until it gets to 50, like that. Perfect, then we'll stop it. Now we are going to use a heat gun and a timer. Want to go 7 rounds up and down. You count 10 seconds going up, 10 seconds going down, 10 seconds, and by the end it should be 1 minute 10 seconds. And then you turn it off. It's really hot. And now you try to adjust it and you take a look and see if it's perfect. And in this case, it is perfect. Beautiful.
This is where we plug the rats in and record their neural activity. This monitor shows software that detects changes in action potential. It records spikes from different channels corresponding to each tetrode. Later, we use spike sorting to clearly see the different action potentials coming from different neurons.
Our lab is trying to understand the neural mechanisms underlying Parkinson's disease in the hippocampus and the motor cortex. Since neuroscience is a relatively new field, our research is not only helping us understand Parkinson's disease, but also the brain as a whole. This will hopefully help improve the livelihood of Parkinson's patients.
So what research and experiments does my lab perform in order to answer their main question? First, we get the rats, and then we have a surgery where we use 6 ora to make them Parkinsonian. And then after a few days, we do a surgery where we implant the tetrodes, which you see in the previous clip on how to make it. Those are lab made. And then we put that in the rat's brain, in the areas that we're interested in, and then after we record activity in the brain, we have the neural activity, and then we also record their behavior along with the neural activity. So we have different sessions. We have the levodopa ketamine session, we have the ketamine saline session, we have different sessions giving the rats different drugs, and then we record how the rats are behaving. In that way, we can analyze the data that we collect, so their behavioral data along with their neural activity. So that's what we do.
Our goal is to show that ketamine is an effective treatment for Levodopa Induced Dyskinesia in Parkinson's disease. So far, we have noticed that the 50 Hz oscillations that ketamine produces affect the 80 Hz oscillations in Levodopa Induced Dyskinesia, and we can tell this behaviorally too in the rats.
Hi, welcome to the Parkinsonian lab. Right now I am pulling 3 ml of saline, but I'm going to tell you what I do as an intern in this lab. As an intern, I help build electrodes, I help assist during surgeries, I practice giving injections, we mount brains on slides, we assist in the recording room, which is where we get neural activity from the rat's brain, and we do so many good stuff. It's just great. I love it.
Given all that I've learned, I have 2 more questions. What are the mechanisms in which Levodopa-induced dyskinesia produces 80 Hz oscillations? How are the neuroplastic and therapeutic effects of ketamine region-specific?
Despite learning a lot this summer, I am still left with so many questions. My 2 main questions are, since ketamine is an anesthesia, would using a drug similar to ketamine have the same effect on LID as ketamine does? And another question is, what mechanism of ketamine causes it to disrupt the 80 Hz oscillations created during LID?